Good day, everyone. This is Francesca Mavel Sarabilio Abello, Group 9 from Section A12. We will now present to you our assigned case study, which we entitled as the threatening infestation of Ascaris Lumbricoides. Abstract. There are over billions of people who are infected by a soil-transmitted parasitic worm worldwide. In human, the Ascariasis disease results when the Ascaris parasite, a roundworm, lives in the intestine due to ingesting such worm eggs from contaminated hands and other source of dirt such as raw vegetables, unwashed fruits, and pipe water. It is reasonable to assume that such case is associated with chronic disability rather than death. This case study presents an exploratory study about a 14-year-old boy with asymptomatic abdominal pain, headache, and vomiting, which is diagnosed with ascariasis, or what we called as the Ascaris lumbricoides, and uses the history of the patient as well as the current health status as the illustration of the condition. The complicacy of being raised in a livestock area where consuming raw vegetables, sipping unclean water are the normal basic routine typically results in this kind of illness. Few of the laboratory tests were done, namely CBC or the complete blood count, stool examination, urinalysis, and liver function tests such as SGPT or ALT or serum glutamic pyruvic transaminase or AST or aspartate aminotransferase. The result of the boy's CBC, urinalysis, and liver function laboratory examinations are within the normal range. The patient's condition shows positive remarks on his stool examination as it shows the presence of Ascaris lumbricoides in his feces or stool. It is traced to his asymptomatic abdominal pain, headache, and vomiting as well as his current address and background of consumption. Furthermore, the stool's color, consistency, and odor were not normal as it gives black, lumpy, and raw meat-like odor. To deliver optimum care around the world, medical technologists and the rest of the medical professionals should give eye on this type of case as this gives negative effects on growth, especially to those children who are undernourished. It burdens not just their physical health, but also their mental health. As to this, there is a need in improving growth rates not just in the poor areas of the Philippines, but also for the dedication in giving our children the life they deserve.
Hello everyone, I am Ella Marca Masara from Section 812. So let's go to the history and background of this case studies. Ascariasis lumbricoides is the largest nematode or roundworm parasitizing the human intestine. This disease is one of the most common human parasitic infections that were identified by the Egyptian mummies from around 800 BC. They are more common in children, also in adults. As many as 500 or 5,000 adult worms may inhabit a single host. The intake of raw vegetables and fruits, as well as occupational or recreational exposure to contaminated soil, and poverty are the main risk factors for this parasite infection in people. According to the World Health Organization, or WHO, intestinal worms are present in about 10% of underdeveloped countries. The A. lumbricoides roundworms spread through ingesting their eggs accidentally from contaminated soils or uncooked foods. Children are the most vulnerable of this disease as they may put their hands directly in their mouth after playing in a contaminated soil. More often, this disease can be passed directly from person to person. So signs and symptoms become prominent when the roundworms grows. So signs and symptoms of lumbricoides. Stage 1 is not that complicated. Worm larvae in the bowels attach to the bowel walls. And for the stage 2, Worm can be larvae migrate into our lungs and also can have this fever and breathing difficulty and also coughing and pneumonia. In stage 3, this is the most complicated. So worms enter the small in our intestine and mature into worms and remain there. So abdominal symptoms, we can feel this abdominal discomfort and intestinal blockage are partial or complete, and severe abdominal pain and also vomiting and also restlessness and also disturbing to our sleep and warm in stool and warm in vomit. But we don't need to worry that much because these infections with A. lumbricoides are easily treated with a number of antiemetic drugs, as this is the first-line treatment of ascariasis. So parental pomote given as a single dose of 10 mg or kilogram, or levamisole given as a single dose of 2.5 mg kilogram, and mebendazole given as a single dose of 500 mg to 400 mg. Obstruction and surgery is used as a last resort. So this prevention, keeping good sanitation condition is the only way to prevent the infection of lumbricoides, and also pollution of soil with human feces should be avoided, and vegetables should be thoroughly washed in a mild solution of potassium permanganate and properly cooked before consumed. And also our finger should be regularly cut to avoid the collection of dirt and eggs below them. And hands should be properly washed with some antiseptic soap before touching anything else or before you're going to eat. And also in this prevention can be achieved by providing populations with access to clean water purifications, sanitations and hygiene awareness, and also personal and environmental hygiene practices. Safe human waste disposable, have sufficient nutrition and healthier. So in this case, I learned that the ascariasis is the most common human hemetic infection globally. The best way to prevent people from getting ascariasis from human or pigs is to always avoid ingesting soil that may be contaminated with human or pig feces, including human fecal matter. So again, I am Ella Marica Masara and we are the Group 9. So thank you and have a great day.
Greetings to everyone, I am Christine Mitch M. Candelada and I am here to talk to you about the components to be examined in the laboratory tests. In our case, a physical examination revealed that the mouth, esophagus, stomach, and first portion of the small intestine were being spoliated, which indicated that a 14-year-old child was suffering from ascariasis. This diagnosis demonstrates that the doctor discovered worms in the patient's vomit, or more precisely in other bodily holes. If we look at his past, he once resided in a livestock raising region in the north of Cebu. As a result, his eating habits indicated that he frequently consumed raw vegetables from fields where there is a high likelihood that ascaris eggs from deceased individuals' excrement that are used as fertilizer had been dumped on the soil. On a regular basis, he also drinks water from a pipe or an open natural pond, both of which may contain a lot of eggs since they are unclean. Therefore, the 4 types of laboratory tests that are requested for the diagnosis of ascariasis are the complete blood count, or CBC, stool examination, urinalysis, and liver function tests. A complete blood count is a common blood test used for a number of conditions or illnesses, including check your general health, diagnosing illnesses, and keeping track of existing ones. Additionally, this can show unusual cell count rises or declines, suggesting a medical issue that needs to be looked into further. Eosinophilia may be visible on a complete blood count. You can get a blood test to determine if you have more eosinophils, a particular kind of white blood cell. Your eosinophils may grow as a result of ascariasis, but there may be other health problems that we could discover when we complete the analysis. A stool examination is a fundamental technique for detecting inflammation, bleeding, obstructions, tumor, and parasite infections in the digestive system and gastrointestinal tract in a clinical setting. To make things clear, stool refers to a human feces or poop. It identifies the varied characteristics of the feces for diagnostic reasons or a collection of tests performed on a stool sample for the differential diagnosis of specific digestive system illnesses. So medical experts can recognize ascariasis by looking at a stool sample under a microscope to check for the presence of eggs. Infections happen everywhere, particularly in temperature zones during the warmer months. In warm, humid locations where sanitation and hygiene are inadequate. When a worm is expelled from their body through their feces or cough up, some people become aware for their illness. A stool examination for eggs may be negative for up to 40 days after infection because the worm needs time to travel and mature.
Now let's move on to urine examination. Urine examination, it is used to identify and treat a variety of illnesses, including diabetes, renal disease, and urogenital infections. Urinalysis involves in examining the color, consistency, and composition of a urine. So in a urine sample, some of the eggs transfer through the intestines or bladder and end up in the urine feces that we can see. Now let's move on to liver function tests. Liver function tests, also known as a liver panel, are used to identify and track liver illnesses or injury, assess various of enzymes, proteins, and other chemicals produced by the liver. Mild elevations are generally considered to be 2 to 3 times higher than the normal range, while elevated liver enzymes often indicate inflammation or damage to cells in the liver. Inflamed or injured liver cells leak higher than the normal amounts of certain chemicals, including liver enzymes, into the bloodstream, elevating liver enzymes in blood tests. Liver function tests examine your liver's general health and can be used to check up for liver illnesses like hepatitis, assess the effectiveness of treatment while keeping track of the development of a condition such as alcoholic or viral hepatitis, and measure the degree of illnesses. I learned that parasitic worms, called Ascariasis, sometimes referred as a hookworm and a whipworm, are brought on by consuming worm eggs. This can occur when eating vegetables or fruits that hasn't been carefully peeled, washed, or cooked, and when putting dirty hands or fingers in your mouth. The risk of infection is very high for people who rear pigs or use pig excrement as fertilizer. It is most frequently observed in tropical and subtropical locations, particularly in places with poor hygienic conditions. These are the several consequences that could happen if ascariasis is left untreated. As a result, we should always take precautions and practice proper personal hygiene. This is Keisha Phil J. Arrogante. We are the Group 9 of Section A12. Thank you and God bless everyone.
Results and interpretation. In this section of the case study, it will center more on the presentation and discussion of the data gathered from the laboratory tests done on the boy that was diagnosed with ascariasis. Additionally, the following tables represent the laboratory test results to give more details on the diagnosis. This is the CBC, or the complete blood count laboratory test result of the boy. We can notice here that the result is within the normal range, just as his hemoglobin is 16.0 grams per deciliter and the standard range is 13.2 to 16.6 grams per deciliter. So this is the stool examination lab result of the boy, where the ailment Ascaris is visible in his feces or in his stool. This is your urinalysis lab result, where everything is within the normal values. Lastly, the liver function test laboratory result, wherein it is also within the normal values. For the conclusion, based on the gathered data and results of the laboratory examinations, his platelet counts as well as the entire components of the CBC laboratory tests are within the acceptable limits. The total bilirubin in his liver function tests is 0.5 milligram per deciliter, which indicates that it is within the normal values. On the other hand, given that the boy lived in a livestock area, the intestinal parasite Ascaris Lumbricoides is detected in his stool sample. There are tons of ways that he might get the parasite: from the pipes to obtain water and from the raw vegetables he consumed. The boy is also displaying certain signs of the infection, such as black, lumpy, and raw meat-like smell of the stool, which indicates that he has an Ascariasis disease. Currently, about 1.1 billion people in the world drink unsafe water, which is responsible for millions of cases of waterborne diseases, which was told by Haddash A 2012. It was one of the major public health problems in many countries, including the Philippines. So, what do you think about digging a bit more in this disease? Undoubtedly, we can surpass little by little the negative effects on growth of undernourished children and provide them the life they deserve. This is Francesca Mabel Sorabilio Abello. We are the Group 9 from Section A12. Thank you and God bless everyone.